So after an assessment, a careful history, a careful physical exam, some plain x-rays, we try to come up with the most likely diagnosis and 2 or 3 differential diagnoses of where the pain is coming from. And we want to design a conservative program that may begin with physical therapy, maybe a consultation with a physiatrist who specializes in rehab, maybe a recommendation for joint mobilization or chiropractic assessment and treatment to mobilize the joints, or manipulations, careful manipulations. These modalities early on, provided they're done by someone experienced that does no harm, can help tremendously. In fact, Michelle, 90% of people get better in 90 days without surgery. And so we would be prudent to support our patients, advise them on their lifestyle, perhaps advise on their nutrition, their weight, their activities, conditioning. Maybe they're doing great conditioning program, but it's all involving impact on hard surfaces, right. So we want to put them in the pool. But basically buy 90 days to allow things to come down and study the situation more carefully. Sometimes they don't respond as favorably as we hope, and we have more invasive means of trying to find out where the pain is coming from. In fact, that period of time, which I call phase 2 treatment, is a period of time that we spend with our patients to identify the so-called pain generator. We really want to know positively and also let the patient know that we know where the pain is coming from. And sometimes we need to turn off the pain generator for a little while to let them know that we know where it's coming from. It's sort of similar to going to a dentist, and he tells you need a root canal, and he puts a little bit of medicine to numb up that nerve, and he's about to take in that dreadful drill and do his thing. And the tooth is not numb yet. And you are going to let him know that he didn't get the right tooth, and it's the tooth next to it that's really hurting. And then he may correct that, and now you can relax and take the drill. It's really similar here. You need to know that I know what the pain generator is, where it's coming from, and what can be done to turn it off. Once you have that confidence, then I can, you know your diagnosis. Based on that, we give you some prognostic factors and options. And then we together, get into a treatment program and implement it.